Another one that is right here with us is a third wave that experts say we're experiencing. I'm talking about COVID-19. Let's speak to Dr. Michael Owusu, virologist with the KCCR. There you are, sir. Good morning, and thank you so much for joining us.
Good morning.
Great. Well, you warned us. I'm not sure if we listened. Do you think we've listened to the experts?
Not really, because this announcement or these warnings was about a month or two ago. But the general populace, I don't think they listened. People thought that it's a story some people are pointing out there to deceive everybody. And others also feel that it is just a gimmick and some means to obtain money for the country. And that is the unfortunate aspect, that many people do not believe that COVID exists, and they think that it is a created artificial, maybe something that is passing through. So unfortunately, we are in this stage because of the way we behave and do our things.
I want my producer and my director to pull out the statistics from the Ghana Health Service, because there's been an update. Active cases are over 3,000 now. So we're back to those days when we all used to be afraid. But Dr. Michael Owusu, people are not afraid of these figures any longer, I'm afraid.
Exactly. So, I was expecting that from last year, March, to this year, it's over 1 year now. I thought that people will now be used to the new norm where we put on masks when we have to, observe our physical distancing, have some alcohol sanitizers by us, avoid large crowds as much as you can, and ensure that you don't work in closed environments where there is a limited air circulation. All these have been said, and it's over a year, but it looks like people are eager to go back to the old lifestyle, what is living freely and living normally. And for a country that, getting vaccines is difficult. We still are struggling to get vaccines that, people will get access to. And for such a country, I think people should just realize where we find ourselves and the need for us to do what is right to protect lives. But in spite of all this, it looks like either people are tired or they just don't want to do what is right.
Well, leaders are tired, aren't they? So the people will obviously be tired, because we've seen all these things happening in the past with the funerals and the large gatherings. And people will point out and say, well, this person did it and they're still standing. So why are you telling me to wear a mask and, all these restrictions that you're still talking about? The UK it was a free day yesterday, and I guess they continue. And again, people here are watching. So if we're seeing all these things happening around us, why should we have that urge to protect ourselves?
Well, I think that it's all misunderstanding. And I know that for the European League and many other football matches, people get excited when they see that people are at the stadium jumping and moving about. But these countries have vaccinated themselves. They've reached some significant numbers, and they've almost reached their target, what you want to call a herd immunity. So what they are doing now is that in as much as they are recording high increase in COVID cases, more numbers, but people are not getting sick. So the rate of hospitalization is drastically reduced. Death has reduced in these countries almost to 0%. So for them, COVID has become like a normal seasonal flu, where you cough and sneeze, and then it goes away by itself, because the body has been trained to fight this virus by itself. But in Africa, we don't have that opportunity, and this is the danger. Although we are hoping to get the vaccines, whilst we are wishing to get new vaccines, I know the UK and the US and many other countries are also hoping to even go for their third dose. and I'm sure that people will think of even a fourth dose. So people are protecting, these countries are protecting their own vaccine to see their populations. And we don't manufacture vaccines. There are plans far advanced, but this is going to take some time. I mean, now we are calling Delta. It's only a matter of time. I'm sure in the next 6 months, another version or another form of this Delta will also start its own outbreak. So if you have large numbers who are not vaccinated, you give the virus that free will to mutate, to infect, to circulate. But if people are cautious and are able to put on their mask, we can avoid that. I mean, Ghana has done well to some level. The airports have improved significantly with rapid testing for COVID antigen. People will expect that these are imported cases in the country. So once you are testing at the airports, why should we have a case? But the point is that if you test 100 people with COVID, you expect 1 or 2 people to escape into the country. So if the people in the country are not adhering, even if you have 1 case in your country, it's only a matter of time. And the whole population. So once people are relaxed and they feel that everything is normal, you can put in the best of effort at the airport. But then eventually this will catch up with you. And this is where we find ourselves. It's as if all the effort that has been put in trying to limit importation of this virus, our own behavior and our own response has given us up once again to this third wave, which is purely based on human behavior, and that is the difficult part that we find.
So is the third wave here already?
Of course, I mean there is no doubt about this. If you look at characteristics of a third wave, a wave is like a sea. I mean it goes up to the peak and comes down. If you have followed through the trend of data from June to now, you see that there has been significant increase in the number of new cases, and this is rising exponentially. And also, you should be aware that in the first wave and second wave, we were testing a lot of asymptomatic cases, which are contacts of those who have the disease. But now, even people who are sneezing and coughing are sick are not willing to go.
Hello, sir. Dr. Michael Owusu.
Fine. So it's few people who are hospitalized and few people who, through the effort of the disease surveillance officers, they do work on an active surveillance to get access to. These are the people, these are the numbers you are seeing. But ask people out there who will not go for tests, who will not report to any facility that they are sick. They are coughing and they are sneezing and they are still attending parties and attending funerals and doing everything. That's the danger. So the numbers we are seeing, it's likely we have 3 times that number in the community. The data is still unfolding. In the Ashanti region, we are lagging behind in terms of the variant. But if I can give you some data, somewhere 3 weeks ago, the total number of viruses sequenced was about 698. As we speak now, we have about 901 viruses sequenced. If you check the numbers, the alpha variant is the predominant. From last year March to date, it's about 363. But then we are likely to cross the 200s to the 400 because this is the trend in Africa. In the whole of Africa, the Delta is now leading with about 1,947 as against the Alpha, which is about 1,879. So because of the strength of this Delta variant, which is about 50 to 60% highly transmissible than the Alpha, is able to infect within a short time. So if you have to screen large people and you have the capacity to sequence large numbers, you are going to find a lot of the Delta. And the Delta that is certainly contributing to this third wave, which is why we keep warning that people should be very careful, especially those who have not vaccinated. And those who are 50 years and above, even for the youth and young people, we have to be very careful.
Okay.
Else, if you get infected with this virus, your rate of survival, if you are not vaccinated, is quite difficult. So we keep up to warn and encourage people to go back to the use of masks and use their Veronica buckets with water, use their alcohol hand sanitizers, and avoid large gatherings. Large parties, beach parties, and all that. As much as you can, avoid these things within this time because the numbers you are seeing will have to rise and hit a peak before it comes down. That is a natural trend that this virus will go through. And I don't know when it will reach the peak, but then I'm sure that in the next couple of weeks, we are going to have this surges and increase in numbers. And the hospitals will feel the impact of it. This is what I think we have to be very careful about.
Absolutely. Well, Dr. Michael Owusu, I think this is apt. Timing is perfect because it's a holiday and people are out there. So thank you very much for the conversation. Thank you for issuing the warning again. Dr. Michael Owusu is a virologist with the KCCR.